Good evening, everyone. We'll just give it a moment to let everybody make their way in we're very excited for tonight's webinar. I think this is our third time together, Dr. Offerdahl, so I'm very excited to hear what you have. I got a little brief, quick synopsis as you went through the slides, and it's going to be very exciting. Some beautiful slides. The design is very beautiful, so we're in for a real treat tonight.
Yeah, looking forward to it. Thanks for hosting.
Oh, thank you. Well, I guess we should get started because people are rolling in, and I know there's so much great information, and we have such little time to get through it all. So, welcome to tonight's Wu University's event, adding PEP to IPL, Collagen Peptides, with Dr. Tracy Offerdahl. I'm your host, Dr. Jennifer Stewart, and thank you to PharmNext for exhibiting at tonight's event. So it is my great pleasure to once again introduce Dr. Tracy Offerdahl. She attended Temple University School of Pharmacy in Philadelphia, PA, for both her undergraduate and graduate degrees. Upon completion of her Doctor of Pharmacy degree, she completed a residency at Temple University Hospital. She's currently on faculty at Pennsylvania College of Optometry at Salus University in the Department of Optometry, where she's the course director and instructor for all systemic pharmacology courses for students in the optometry, audiology, and physician assistant programs. Additionally, she's a practicing clinical pharmacist, and she's a fellow in the American Academy of Optometry. With that, welcome once again. We are so excited to hear from you, and I'm going to turn it over to you.
Thanks. Thanks for the introduction, Dr. Stewart. So we're going to get going here. Of course, we just need to go through the financial disclosures for this presentation. The only thing I have to disclose is a non-salaried affiliation agreement with PharmNext, and most importantly, all financial relationships have been mitigated for the purpose of this program. So this is an interesting topic. I made the slides all kinds of bright colors and fun different things on the various slides, which I don't get to do very often. But it's an interesting topic for a couple of reasons. One, because it's such a timely discussion. Peptides are so big in medicine right now and in beauty. When you think of peptides kind of across the board, we have to include things like even insulin, the Wegovy, the Ozempic, the Mounjaro, the Zepbound. They're all peptides. Then of course, collagen, the collagen peptides, very specific type of collagen that we'll be talking about. So we can't go through this without at least kind of mentioning the biochemistry of peptides. So we won't get too deep into the weeds, but the discussion about peptide structure and the collagen peptides in terms of their size and how they're different from other types of peptides is important because this is what actually will determine whether or not recommending a collagen supplement to a patient is going to even do anything. So it's kind of a combination of biochemistry from a medicinal support perspective, but also from a beauty perspective. So we're going to do a little bit of both and try to keep it fun and moving along here. So I call it functional aesthetics in optometric practices. And when I say functional aesthetics, functional really just means from a medicine perspective. If you've ever heard me speak about this, or Greg Caldwell, is a great friend of mine, and he also speaks on this. Functional medicine just means kind of figuring out the root cause. And when you look at functional aesthetics, that's why something like collagen peptides are so perfect for use with techniques and therapies like IPL, radio frequency, photobiomodulation, et cetera. So, I kind of focused on IPL just because it fit into my pithy little title, but certainly with other surface therapy interventions for sure. I'll also mention that, of course, depending upon the state and what your scope of practice looks like, some of you may be doing strictly dry eye with IPL. Some of you maybe are able to do, and neck and even sort of the top of the chest with some of these surface therapies. But no matter what your ability to practice looks like in terms of scope for these types of techniques, collagen peptides work across the board, and that's the beautiful thing. So just last comment, going back to the functional portion of this, when you think of a collagen peptide, and this is what I'm going to try to show you over the next little bit of time, we are addressing the inside out. And really, that's, kind of that beauty from within perspective of things. What's going on the inside certainly is something that we start to see on the outside. And we know that, very well from a nutritional and you guys as eye physicians in particular. So we'll talk about that. The real secret to a beautiful outside begins on the inside. So beauty from within is what it's all about. And I liked this slide because it's just taking some information from some consumer research groups. So I have just some numbers to throw in to kind of get us set up here at the beginning. Topical beauty is no longer enough for today's consumers. 68% in this particular research group believe that they get more beauty benefits by what they put in their bodies rather than just solely on the outside. So that's, again, an important perspective to consider here. This is a trend that's growing very, very quickly in terms of supplements in particular. Look at these numbers. Trend forecasters predict the health and beauty supplement market to reach 68.9 billion by 2026. So it's a pretty sweet number. And if you look at even 2019 to 2026, I mean, that's $20 billion increase in market size. That's a huge opportunity for practitioners that can have an aesthetic component to their practices. And certainly you folks as eye physicians are set up perfectly for these types of products, even if you just do a little bit of it. Not everybody has to be kind of a full aesthetic or beauty practice, but it certainly can be part of what you do and a service to your patients. Patients want, of course, with all of this, the safety, the efficacy, and the reassurance of supplements from experts. And that's you. I mean, you guys are health experts, you're medical experts in your fields. So you are the experts in the eyes of your patients. And that's why we're all here, right? You can offer this to patients with things that are, really considered beauty brands. Okay, so getting into just a little bit of the science, since this is an educational program, getting into some of the science regarding intense pulse light therapy, which you could probably speak more to it even than I can. But some synonyms for it: flash lamp therapy and photorejuvenation. It's certainly popular, mainly because it's non-invasive, it's non-surgical, as you all know. People can get it done in a short period of time and, even on their lunch break, and then go back to work, and nobody knows that they had it done even, rather than comparing it to some of the other dermatologic interventions that people get, like microdermabrasion, true laser therapy, etc. Sometimes those are taking 3, 4, 5 days before skin starts to look rejuvenated and really normal, instead of, kind of like ground beef in some cases for a temporary period of time. You don't get that with radiofrequency photobiomodulation or IPL. It does use the principle of lasers. However, it's not, a true laser that's causing that intense ablative effect and resurfacing. So this was just a cool graphic showing light therapy and the various colors. And again, emphasizing that this is a surface therapy practice, and why collagen peptides will work so well with these types of interventions. So again, depending upon what your practice, what you want your practice to look like from, a supplement perspective, or even what the state allows you to do in terms of interventions like this, you may do some of this. You may be more limited, or you may choose to be more limited. But benefits of IPL: targets dry eye, and meibomian gland dysfunction, of course, fine lines and wrinkles, vascular lesions, broken veins, rosy cheeks, rosacea, freckles, age marks, and even can help with unwanted dark hair that has no pigment in it. Is not impacted like dark hair, which has always been true for laser hair removal and things, similar to this. So, different estheticians and dermatology offices may order or may offer rather a more expanded list of benefits from IPL and similar type therapies. But certainly you can offer many of these where collagen will benefit a patient. So just a real quick rundown on IPL for dry eye, particularly helpful in those that have meibomian gland dysfunction. And I read the statistic a couple of weeks ago, and I think it was from Dry Eye Guys, which probably many, if not all of you, are familiar with, that group of doctors. So it said 90% of individuals dealing with dry eye have some degree of meibomian gland dysfunction. So As you know, meibomian gland dysfunction is seen in rosacea as well as other inflammatory or autoimmune type conditions. For a long time, rosacea wasn't really considered to be autoimmune, but it really is in most medical circles. It is considered to be an autoimmune disease, certainly inflammatory, and probably an autoimmune component as well. So just showing you kind of how IPL is going to target this area with meibomian glands. When the eyelids have abnormal dilation of blood vessels, you get the telangiectasia, inflammation to the surface of the eyelid, and then dysfunction of meibomian glands. So just some of the, proposed pathophysiology of what can happen in meibomian gland dysfunction and dry eye. So long-term benefits of using IPL specifically, and then we're going to add, of course, the collagen component to it here in a little bit. But IPL causes the photocoagulation of the abnormal blood vessels and photorejuvenation of those skin cells. And then it stimulates the meibomian glands to produce this, sort of better oil, as I saw described in a couple of other places. Helps dilate the meibomian glands and then sort of liquefying of the meibum. So then I think most of where I read, and for those that I've spoken to that do this, they express the meibomian glands either manually or with some of the cool gadgets that are out there now, the LipiFlow, MeiboFlow, et cetera. And oh, by the way, I will mention some products during the discussion, as well as maybe some devices, and I'm not claiming superiority of one versus the other during this discussion at all. So patients get almost spontaneous, more instantaneous relief of symptoms when this is done with the IPL for meibomian gland expression and improvement. IPL can also treat bacteria and Demodex. And so the thought is that there can be improvement in blepharitis for some patients as well. So there are a lot of ways that IPL can, sort of help fix the meibomian gland dysfunction, inflammation, and those clogged glands. Side effects of IPL, and then we'll get kind of to the meat and potatoes of this with the collagen. Really a well-tolerated procedure, therapy for sure. Some patients say it's a little bit painful. Others say it isn't really, bothersome much at all, kind of like maybe a little pinching feeling. There are certainly sun risks anytime we're doing something with the skin. I mean, really, even if you don't have something done with the skin, we should always consider sun risks and exposure from an oxidative stress perspective, and then even just from further breakdown of collagen and, the structural connective tissues in and on the skin. So always wearing sunscreen after IPL. And then, in the literature, you see some retinal damage, loss of vision, but mostly those are cases where somebody either didn't wear protective eyewear or it wasn't done, used appropriately, and maybe some technique issues as well. And then skin surface burns you can find in the literature as well. Generally with IPL and the meibomian gland dysfunction, or even IPL, for other reasons, more aesthetic or dermatologic rather than dry eye, it's, some, 3, 4, 5 initial treatments, about 3 to 5 weeks apart, and then once annually. And, the thought behind using the collagen peptides is this is something that is going to build over time because we are impacting skin and skin structures. So just like IPL, radio frequency or photobiomodulation, that is the science behind the collagen peptides as well. This isn't something that's going to, it's not like a cream you put on your face and automatically you look much better or notice a difference. This is something that is impacting connective tissue, and it's going to take time before we see a real improvement in skin, within a few weeks, and then it starts to peak in, 6, 7 weeks. And then you have to maintain it for sure. Not like collagen injections or anything like that. So again, just another number to kind of lighten it up here, just for a very small moment from this consumer research group again. 82% of consumers believe supplements can improve their outward appearance too. So not only just make them healthier, hopefully inside, supplementing a good diet. And that's why it's an important consideration that supplements should never really, I mean, I hate to say never, and I never say always, but supplements have that name for a reason because they should be adding benefit to a well-balanced diet. I never say a perfect diet because nobody has a perfect diet. But these consumers also believe the youthful, glowing skin, gorgeous hair, and beautiful, strong nails can be a component of supplements. And I always say that human digestion is a bit of a, I hate to say random, but it really is. Human digestion is a bit of a random act. We can't look from one person to another person to another person and predict very well how they will digest and absorb food, digest and absorb, or liberate and absorb medication, supplements, etc. There are so many things that impact our bodies on a daily basis. And, our gastrointestinal tract is kind of like an outside system inside of us. So we don't have a lot of control over things to a certain extent. So we can't really predict how any of these supplements are going to do their job, not waste our money, and can we actually see a benefit from them? And the good news is that's what I love to do, sort through the information and find products that work. So a lot of consumers state that they haven't found beauty and wellness products that are designed to work even better together for jaw-dropping results. This is not my verbiage. This is verbiage from some of the consumer research information. So how do you know what you're getting? How do we know the supplements are actually coming from a company and from sources that we know we can trust? Well, that's what research does for us. And I always say, and I kind of say that this is my second installment of my Ingredients Matter webinar series that I've been working on. And ingredients do matter. I mean, we know ingredients matter from a food perspective. I always say, even like self tanners that are so big right now, which I've never used a self tanner. I always figure, I don't know, I'll end up looking streaky and kind of a weird color. But that even is impactful. What we put on our skin, whether it's sunscreen, our self tanners, our moisturizers, our cleansers, our makeup, you should be willing to take anything that you put on your skin, look at the ingredients, and say to yourself, I would eat that as food. And if you can't say that because you have no idea what it is, or even if it's safe, or you look online and you see that there are questionable ingredients in something, then you certainly shouldn't be putting it on your skin either. So ingredients matter no matter how we're using them in and on our body. And that includes food for sure. Okay, getting to the collagen here. So what is collagen and what's all the hype? Health or hype? And, probably a little bit of both, depending upon what products we're talking about. But I feel very confident that if you find a good, solid company that's producing consistently well-made, sustainable, and clean products, then you really have found gold. So according to the Journal of Clinical and Aesthetic Dermatology, the principle behind using IPL, along with collagen, heating collagen fibers with high intensity light energy causes constriction. This leads to new collagen formation, resulting in skin that looks and feels smooth, firm, and youthful. But imagine sort of resetting the skin time clock, because somebody who's 25 having IPL is going to have a heck of a lot of a better outcome because they already have a good amount of endogenous collagen there, and the collagen is actually nice and pliable and supple like it should be. Whereas you compare that to somebody like me, I'll be 55 on my next birthday. No matter how hard I try, I'm 55. So there are things that I have to do now to make IPL work like it's supposed to, that wouldn't be so hard when I was 25, 30 years or younger, than I am now. But it's doable. It's doable. And again, it's using kind of this additive or synergistic combination of therapies. And we'll talk a little bit about where some of this data comes from, where I can confidently say to you, it is additive to use collagen peptides plus IPL radiofrequency photobiomodulation, and maybe even synergistic, the two of them. So we'll look at that in a minute. Okay, let's just take a quick moment to look at endogenous collagen, just to remind you of its purposes in the body, and on the skin, and also why the probably the most well thought of producing type of exogenous collagen for supplement purposes. So endogenously, collagen is the most abundant protein in the human body. It's made up of amino acids, and those amino acids vary three specific ones: proline, glycine, and hydroxyproline. they form a triple helix, and it's, biochemistry at its finest. This is the stuff I love. Hopefully I won't make too many of you cry with flashbacks back to biochemistry, but this is just the miracle of how all these things work in the human body. So this is the triple helix, and this is just a little cutout point, that is made bigger, enlarged, I guess, zoomed in, so you can see these beautiful little amino acid, cartoon drawing of it, but you get the picture. This is going to be important because collagen as a structure is huge, humongous, and we don't absorb that well. I mean, even things like trying to get protein from our food sources. I mean, we have to think about how many times we're chewing a piece of meat, because the more you macerate it and break it down, the more likely you are to absorb that protein, instead of inhaling our lunches at 50 miles per hour because we only have 10 minutes of lunch between patients. I get that. But it does matter, the actual size of the proteins and the peptides, et cetera. That is everything as it pertains to whether or not these products are going to work. All right, so we've got the triple helix here, we've got the amino acids, and now we're just starting to look at the word peptide, and we'll get more into that. 28 different types of collagens have been identified, and I have 5 of them here. I added the 5th just because it's involved, identified collagen in cornea, layers of the skin, hair tissue, placenta. That's type 5. But notice I have type 1 and type 4 in bold. Type 1 collagen is specifically for skin, but bones, tendons, ligaments. So you can see it's all connective tissue stuff with collagen and these particular types of amino acid proteins, which maybe is a little redundant. Type 2, elastic cartilage and joint support. Type 3, muscles, arteries, organs. Notice organs are there. We'll get to that in a moment again. And type 4, layers of the skin. So the type of collagen that is in a specific supplement does make a difference. 90% of the collagen that we have in our bodies is type 1, 2, 3 combination, type 1, 2, and 3, with the large majority being type 1 collagen. So you'll see different supplements that are out there and available, everywhere from the gas station to high-end boutiques, et cetera, and online. And they use different types of collagen for different purposes. Good and bad, it sort of depends upon the scenario. But we're really going to focus in on type 1 collagen tonight. That's going to be the key for skin and even nails, and just sort of, a youthful look overall. So endogenous collagen, once again, there's just a picture up here just showing you some of the functions. And I want to run through a couple of slides because we have to have a quick perspective on the endogenous, a reminder to understand how we're going to approach exogenous supplementation of this substance. So collagen is a building block for connective tissues. You just saw that on the previous slide with type 1, type 2, type 3, type 4, type 5. It's found in skin, muscles, bones, tendons, ligaments. It's also found in organs, blood vessels, and the gut lining. Now, I remember a while ago when I, learned the significance of collagen, even in the gut lining, and keeping it intact and together. If you've ever heard of leaky gut, this is something that the best research and science believes collagen may also be involved in. It's not the entire sequence of events that's causing a leaky gut type problem and autoimmune disease down the line. Leaky gut literally means you have stool leaking into your bloodstream, because it shouldn't, right? It's supposed to go from, food from our mouth all the way, travel down and leave our body, obviously, through the anus. But leaky gut, where collagen structural integrity is impaired, as well as other things, then this is something that can be benefited with collagen supplementation. Supports fibroblasts in the dermis. So now we're talking about the skin. It helps cells grow. Important in replacing dead skin cells. So there's that photobiomodulation, the rejuvenation, the surface therapies that we're dealing with here, and then protective covering for organs, which I already mentioned. So if you don't have good, solid collagen, not just skin is being impacted. There's more to it. So again, it provides structure, strength, and elasticity to the skin. So you kind of can at least draw a quick connection between all the different places where collagen, or many of the different places where collagen has an important role. So endogenous collagen, I mean, look at this picture up here. It's sort of AI generated, but aging and wrinkles. This is age 30, this is age 40, and this is age 50. What I want to see, or what I want you to see here is this top little line here is supposed to be the surface of the skin. And you have the epidermis, you have elastin and collagen, and see what a beautiful, nice, tidy matrix it is at age 30. I think this is probably a little bit older than the perfect picture I would have put in here, but it gets the job done. And what I mean by that is we know that, not much past 23, 24, we really start to see this matrix of elastin, collagen, and in the epidermis starting to break down and not have such an intact structure. So you can see even by age 40, the surface of the skin is starting to get those deeper wrinkles, lines and wrinkles. And look at the epidermis by the time someone is age 50. And let me tell you what, I'm not going down without a fight. So far, I've avoided Botox and collagen injections and things like that, or Juvederm or some of those others. But not saying I won't try it if I think I need it down the line. So, again, trying to approach things from the inside out, and it really does make a difference. So there are a lot of different ways that we can kind of approach the lines and wrinkles, but, trying to stay more holistic and functional. Collagen breaks down faster as we age. This number says 1+% per year after the age of 25. That's what most of our research shows us. And I also would like to mention with that I kind of follow the 1.5% number. So my brain and what I've read and the best research that I can find says that it's aging even faster than the 1%. So 1.5% per year after the age of 25. So I don't know if I do the quick math, almost 55, I'm almost completely out of collagen based upon those statistics, or pretty darn close. So that is a consideration. What we do make and what we do have in terms of collagen by the time we're 50, 60, 70 is of lower quality. It's more brittle and it doesn't hold up as well. So what else impacts our collagen production, as well as what we do have, how well it holds up? So not just the actual quantity of collagen, but the quality as well. Menopause. Everybody who's gone through menopause, me included, has noticed, more wrinkles, that crepey skin in certain areas, which, gets worse as we age. Sagging, you can even, see sagging in the face structures, muscle shrink and weaken, tendons and ligaments are stiff and less flexible. So it's not just on our face and the tissue and muscles, et cetera, that are holding up our cheeks and our foreheads and everything else in our neck, but also in the rest of the body. I mean, I certainly know I'm not as bendy as I used to be. Smoking, UV light, those are no-brainers for sure. Anybody knows that smoking is bad for you no matter what we're talking about. And certainly UV light and sun exposure can be problematic. So it's a delicate balance between getting some sun for appropriate vitamin D and just sort of grounding and meditation purposes, but also trying to maintain our skin. Autoimmune disease, genetic mutations, so, true connective tissue issues, and there are, decent number of those. Sugar, refined carbs, this might be an interesting one for you. This one is maybe one you hadn't considered, but sugar, processed carbohydrates, so the simple sugars and things like that, they attach to proteins and it causes glycation. Collagen and other proteins become weaker and dry and brittle from sugar and refined carbs. So I guess we have to put down the gummy bears and move on to an apple. I guess that's the moral of the story. What else fits in here? Alcohol use. That can affect our endogenous collagen, not only the production, but the quality of it. So quantity and quality. And then I also thought of another, sedentary lifestyle. That can certainly have an impact on it as well. And that might seem strange, but if you have an interest in that, shoot me an email. I can send you some stuff. But when you think of a more sedentary lifestyle, you're thinking oxidative stress, and sugar being pushed into adipose tissue at an alarming rate, insulin resistance, et cetera. It's all interconnected. You cannot separate them. So Looking at just sort of graphics of what this collagen elastin matrix looks like, again, age 23, age 75, and then old skin, age 75, should say older skin. I don't like old, but plus sun exposure. Look at that drastic change. I mean, this is obviously just a sort of graphic novel version of it. But if you look over here to the right, it's the same type of thing with actual little slices of skin. Young skin, 23, the red is the collagen. Old skin, age 75, you can see that the collagen is lower in quantity as well as quality, particularly a little deeper. And then old skin plus sun exposure, look at that. So it may sound silly, but I say nobody needs to look like a rotisserie chicken when they're 75, right? Everybody maybe looks good with a little sun-kissed face occasionally or body, but it adds up. It's a cumulative problem over time. Okay. Now, you have the building blocks, literally and figuratively, from the reminder through endogenous discussion. So I'm just going to break it down very simply and show you why some products are far beyond better than others. And there are a lot of choices out there for collagen peptides, just like every other dietary supplement. It's hard to sort through everything. Collagen is a protein that is best absorbed and digested when it is broken down into smaller amino acid chains, and that's where we get the word peptide. So peptides literally just means small chains of amino acids. So really quick, this is something, it's a technique, bioactive collagen peptides. So you hear a lot of different manufacturers make bioactive collagen peptides. So it's a two-step process, which is significant. And the end point is really the key here. So just real quick, I want to show you, I'm trying to get rid of this bottom thing here. Let me make this go down. Wait. Oh, I can't get. All right. So I put my graphics up too quickly, but this is what we have. It's a controlled sequence of events. Here we have the triple helix. So this is collagen. And then either thermal or chemical treatment of the triple helix. It's called denaturing. The collagen is actually broken down into three individual amino acid strands. So one would be proline, one would be glycine, and one would be hydroxyproline. So they're already now taken out of that triple helix and made into three individual strands. So then a final step gives this enzymatic hydrolysis. And so one thing that you hear frequently is hydrolyzed collagen peptides. And that's a big, kind of target audience. If anybody knows about like the term hydrolyzed in biochemistry, it's something that people use in marketing and advertising, but it doesn't always mean something. You have to make sure you have a product where this hydrolyzed collagen peptides actually mean something. So this first step, this is what happens in all collagen manufacturing, dietary supplements. It happens in all of them. It's not a fancy step. This last step where we're making these three amino acid strands into tiny little pieces of themselves, these are the peptides. This is where it counts. And the actual size, the molecular weight of those peptides is key to everything. So that's what I was trying to show you at the bottom. It's 2 kilodaltons. We'll hit that number again here in a second. But I wanted to show you just a peptide is 2 to 50 amino acids, whereas a protein is anything greater than 50 amino acids. So it just has to do with sort of how they're bound together and the length of the chains themselves. And I thought I had another graphic here, but oh, there we go. Here are the amino acids individually. Here's a peptide, and here's the protein, where it's just more amino acids put together in a certain type of structure. Okay, so what sets the collagen peptides apart from the many choices out there is what's happening in this hydrolysis step, which I already mentioned. And I already mentioned hydrolyzed collagen peptides, but it means nothing if the actual size of these collagen peptides isn't something that is followed for production of a dietary supplement. So I already mentioned the metabolism comment that I put over here on the right in case I forgot to mention it, but this is what gives us a usable form, and not all products have a usable form of collagen peptides. So while that product may not hurt you, it may not benefit a patient. Why take something if the only thing we're going to get is nothing, but it's not going to much good. So it's this specific enzymatic process. It's this 2 kilodalton. That's the standard that we want in our collagen peptide products. Anything bigger, absorption is greatly diminished. So again, ingredients matter. Lots of different tests and research and studies have looked at trying to find the optimal size for the peptides. 2 kilodaltons is the most effective size for producing collagen and elastin production in the skin, and tiny differences do impact the ability of the product to stimulate collagen. And that is everything, because that's the whole reason why we're saying use collagen peptides, use them by themselves, but even more so, use them with a surface therapy device, the IPL, the radio frequency, the photobiomodulation, and even something as simple as a handheld spa, like a home spa. They work great as well. And that's where we get a lot of our research looking at surface treatments plus collagen peptides and how they can benefit people. So over here, I have collagen peptides are superior to just plain collagen. In other words, we need the peptides. So it's looking at a more highly digestible product, a better absorbed product, and more easy distribution throughout the body. I mean, think back to pharmacology, which you may or may not want to do. But distribution means everything as it pertains to drug therapy, right? So it would be no different if we're talking about dietary supplements or nutrients. If a chemical can't get to a location in the body, it can't help something in that location, and it certainly can't cause side effects either. But distribution is the question you have to ask. Is this going to benefit my patient? I mean, the eye is a great example, right? It's a tough place to get medication and nutrients and antioxidants, carotenoids. It's a tough thing to get substances in there in the inner retina and outer retina unless everything is lining up nicely. But size matters as well. Collagen is big, upwards of about 300 kilodaltons. Our collagen peptides are 1 to 8 kilodaltons. That's the range you find in collagen peptide products on the market currently. We want the ones that are consistently coming in at 2 kilodaltons across the board inside the actual supplement itself. So real quick, it's a naturally occurring protein, right? So we get our sources from fish, you can get cow, pig, you can get chicken collagen, vegetable collagen. There really is no such thing as vegetable-based collagen. It's just that vegetables contain the minerals and the vitamins necessary to support collagen production. So I'm not saying don't use vegetable-based supplements. I'm saying, or something that's mimicking kind of a comprehensive, perfect diet. That's certainly something that I take every single day, but that's not replacing collagen. That's just making the collagen work better, right? Everything in the body works as a cofactor for something else. Everything in the body is made for us to be self-healing organisms. And, we're the ones that ultimately dork that up right out of the chute, literally. So, the main thing, as you probably know, any of these sources, whether it's fish, cow, pig, vegetable for support, and chicken, all of them can contain contaminants. You have to know the sources. You have to know what those animals were fed. You have to know how they were butchered, more or less, and what their exposures were. So that means everything. Again, if we're going to put it in our mouth as food, we should have the same set of standards for what we're putting in our body for nutritional support of various things. So again, just kind of going along with this distribution, and we're heading to towards the end here in the next 10, 12 minutes, where I'm just going to show you some data, slides from studies from various products, showing you the benefits of using these with potentially with IPL for a synergistic improvement. All right, real quick, I already mentioned the distribution. The dietary supplements, just like anything else, they have to get to a location in order to help it. So here again is that dual action process that we were kind of talking about with the denaturing of the triple helix into 3 strands of amino acids. That actually is gelatin gelatin. Oh, by the way, so let me just go back 2 slides. I just want to show you because I forgot to mention it. Here's the triple helix, a controlled treatment, either thermal or chemical. It's called denaturing of the collagen. It forms these 3 amino acid strands. This is actually gelatin. And why so many people, years ago, I remember my mom used to take unflavored gelatin as a collagen supplement. I remember it, 40 years ago or more, probably closer to 50. And my mom still has beautiful skin at 80 years old. So who knows? Maybe it was the gelatin. But she's also a very good eater and exercises religiously. So keep that gelatin in mind. I want to show you something else with it. All right, dual action. This is sort of a generic reaction, this building block, and meaning all collagen supplements go through that first step. But what's key is this cell signaling. So just remember, drugs work because they get to a location, but once they're in a location, they work because they're plugging into a receptor, right? That's everything. A drug receptor complex is what is going to translate into an agonist effect, an antagonist effect, good, bad, and everything in between. So this cell signaling is even important for collagen peptides. I mean, we are using externally, exogenously, something that we're trying to mimic, replace, improve endogenously. So it is literally a bioactive collagen peptide supplement that can plug into a receptor with a unique collagen peptide fingerprint that makes it work. Why waste our time and money if we don't have the ability to do this and to prove it? There are lots of different things, various companies that will add other nutrients to collagen peptide products. You see tons of things. This just happens to be one of my favorite combinations. So there are products out there that contain the phytoceramides and the lutein as well. Of course, as eye physicians, you understand the significance of lutein in terms of oxidative stress and filtering out blue light, et cetera. So lutein is going to be a great addition for those products that contain it. Phytoceramides as well. This has to do with hydration of the skin. So if you look at phytoceramides, it says right here in the picture, help support skin hydration. I sort of describe it as, instead of making it something a little more nebulous, make it a little bit more relatable. So at night, I have like a 5-step process of creams and cleansers and stuff that I use. And then when everything is said and done, I do an oil-based product on my skin to seal in the moisture. That's what a phytoceramide does. I mean, it doesn't look like Vaseline or beef tallow. I actually put beef lard on my face, to kind of seal in the moisturizers that I've used during the day, and also what I put on before bed. That's what a phytoceramide can do structurally as well. It's that lipid-based layer on the skin that doesn't allow so much transepidermal water loss. Whew, it's a lot for 9:15 on the East Coast. All right, real quick. Bioactive collagen peptides, once again, there are products that have optimized the bioactive collagen peptides for beauty purposes. So these are just some comparisons. Here is an example of a bioactive collagen peptide. This is in vitro collagen biosynthesis. So this is in vitro, and most dietary supplement companies, that's all they do, in vitro, if they even do that. Because the laws are not so strict in the United States in particular, and we're pretty bad at regulating it. But so most companies are going to do in vitro, right? Petri dish type studies. So this is just a one bioactive collagen peptide company. We're looking at in vitro collagen biosynthesis. So the collagen biosynthesis was excellent with bioactive collagen peptides, right? Okay, that's great. This was just sort of a generic run-of-the-mill common collagen product. I mean, we got some mileage out of it, but not as good as the bioactive one, right? This next one here, this is gelatin. This is Jello, unflavored Jello, I guess is the brand name. Gelatin is just that denatured collagen. Gelatin didn't even get us very far. Here are the individual amino acids. They didn't give us enough. Remember, everything works together. You can't just give a single amino acid and expect to get the full picture from it. Our bodies do not work that way. We are a giant chemical reaction. So even just combining 2 of the amino acids together didn't really give us much in terms of in vitro collagen synthesis and collagen production in the fibroblasts of the epidermis. All right, rolling out the data here, just showing you we're in good shape time-wise. This was one example from a study. A company did a double-blind placebo-controlled clinical trial, and it was looking at the study design was 60 healthy non-smoking women and men 40 to 60 years old. They were randomized to either collagen peptides or placebo. They looked exactly the same. They couldn't tell the difference between the two. That's why it was double blinded, or, of course, because it was double blinded, they couldn't tell anything about the difference between the control group versus the placebo. And there was an outside third-party tested dermatology group that was assessing the skin change improvement over time. So this is literally just at 4 months after using a collagen peptide versus placebo. So this was percent improvement from baseline. So these scales are a little bit different, but you can see, compared to placebo, the overall appearance from a blinded dermatology practitioner, was a dermatologist, we had significant improvement in overall appearance with the collagen peptide. Same thing with texture compared to placebo at 4 months, significant improvement in texture. Radiance, same thing, significant improvement in radiance with collagen versus placebo in this group of 60 men and women, 40 to 60 years old. So really, a lot of the age group that we're targeting with this type of product. And there are that's the reference to the study below. If you want it, let me know. So again, this is just looking at a collagen peptide plus a handheld spa. So that's, some spas are better than others, but they're, using different techniques to work as kind of like a surface therapy. Of course, not as intensive or probably quite as effective, maybe is the right word to use, as IPL or radiofrequency or photobiomodulation. But then we can use them all together, a good skincare routine for patients. So this is just showing, again, this is just the handheld spa by itself. Definitely some improvement in texture, percent improvement over baseline. And again, this was at 4 months. But placebo, the spa by itself, you got an improvement in texture. But when you added the collagen to it as well, look at that. Look at that. We really had, kind of a rocket to the top, and this was radiance. Again, this was blinded, double blinded. And the purpose of this was just for me to add an example of how, surface treatments do make a difference as it pertains to people using collagen peptides. So collagen peptides by themselves, great. Surface treatments by themselves, great. When you put the two of them together, beauty, additive, if not synergistic improvement in most situations. And again, this was one of the other legs of one of the studies that I was looking at. But what I wanted to just show you here was that, again, this is just percent improvement. This was not number of people, but if you look at radiance, and there are scales over here, it's a little hard to see. But what I wanted you to notice is that you see, almost 100% improvement in radiance, almost a 100% improvement in texture, 52% improvement in firmness, and almost 100% improvement in overall appearance after 4 months of using the collagen peptides. And I think it was with the hand, like a little hand spa as well. The handheld facial spa. But they had a high probability of showing mild to no further signs of aging at 4 months. Again, specific information with a handheld spa, but it's a nice high-end one, the particular one that they were using, and it's showing you the potential of IPL and these other surface therapy interventions. Okay. So again, just more data, and I have the studies for you if you want them. Really just beautiful improvement. This is something that I sort of modified. This is kind of one of the ways that I assess different products, certainly the price of things per dose, free shipping, but usually all the other stuff that's in there. We want products that are going to help protect against the damaging effects of oxidative stressors like blue light. We want something that supports hydration. We want something that's gluten-free, helps improve skin radiance, boosts collagen and elastin production, zero artificial colors, flavors, or sweeteners. Now, some products do contain stevia is how I say it. That is a plant-based sweetener. While I would not be a big advocate of that, in everything or many things. Some of these products do contain stevia or stevia as a plant-based sweetener. That is not a sugar alcohol. It is not an artificial sweetener. So pound for pound, that's an okay thing. And many of these are very unpalatable without a little bit of fruit-based flavoring. So some of them do that. The gluten-free thing, depending upon the company, most companies, if they're reputable companies, will make something gluten-free, and that just has to do with parts per million. If somebody has a life-threatening allergy, I don't believe the FDA definition of gluten. That's a whole different discussion. But most people are fine if it's an intolerance. So that's it, right? That's what we want. We want results that are mirror clear, boosts collagen and elastin production, improves radiance, texture, decreases oxidative stress, decreases our blue light issues that come from just being a human, people being people, helps with moisture, reduces fine lines and wrinkles, right? That's what we're all shooting for.